So for me, there are 4 key phases after a hip replacement. The first one of those is the first 2 weeks, and that's essentially the time in which it takes the skin to heal up, and you're going to reduce the risk of any infections or problems with the wound happening. The second phase, so that relates to the healing of the deep tissues and making sure that you've got a nice, stable, solid hip. Third phase, so this relates to the bone growing into the implants and making sure that they are nicely, solidly fixed. So usually by this stage, you can start to increase the types of activity and introduce some of that impact type activity that's been difficult up to now. And the final phase relates to the reconditioning of your muscles. So when you've got arthritis, the muscles around your hip tend to waste away. And it can take you several months, maybe even a year or so, to build them up to being the best that they can be. And by this stage, you should be feeling really, really good and hopefully forgetting you've even had a hip replacement done. After hip replacement surgery, we want to get you walking as soon as possible. So ideally on the same day as the operation. Now, obviously, we want you supported and we don't want you tripping over or having falls or anything like that early on. So we nearly always advise that you use some walking aids to start with. And at this point, it's then about gradually increasing the amount that you do. So I usually suggest that people use at least one crutch or a walking stick for around 6 weeks after the surgery itself. That's even if you don't really feel you need it. It's made to slow you down and make sure you allow time for your body to recover and that the tissues themselves can heal up really, really nicely so you get a perfect result. In terms of driving, for most people, you can decide whether you are ready to go back to driving when you are able to safely control the vehicle, perform an emergency stop, and you're no longer taking any of the strong opiate type painkillers that might affect your reaction times. From the point of view of day-to-day activities, again, it can be different for everybody, but returning to things like light housework and cooking and cleaning and those sorts of things, you'd be looking at around 6 weeks down the line is a fairly typical sort of time frame. So the types of exercises that you do vary a little bit according to the time after the surgery. So initially, bed exercises are usually recommended, things like heel slides and ankle pumps. And this is just to make sure that you don't get stiff and you help to keep the blood pumping around your legs. Walking is an excellent exercise and it's probably the main thing that most people are going to concentrate on after having had the surgery. With this, I usually recommend that you think about getting a step counter and looking at very gradually increasing the number of steps you undertake on average each week, usually by about 10% or so. The gradual increase in activity is really important because your body is healing and your muscles and tendons have got to get used to their new level of activity and their new movements that they're going to be undertaking with your nice mobile hip joint. So the sorts of complications that we think about around the time of hip replacement surgery are infections, fractures, and dislocations of the hip. Now, fortunately, most of these things are very uncommon, but there are lots of things that you can do as a patient to try and reduce your risk of these things happening. And this starts before the surgery itself. So stopping smoking, keeping to a healthy weight, and making sure that when you come in for the surgery, you're fit and healthy with no cuts or grazes anywhere that might introduce infection into your body is really important. After the surgery itself, look after your surgical incision, keep it nice and clean and dry with the dressings in situ. And in terms of exercise and so forth, just take it gentle, let your body heal. Don't do too much too quickly, as you can start to run into problems with aches and pains and causing unnecessary injuries that can be taken with a more gentle, gradual increase that ultimately means that you'll heal better and faster.